Hi there, it's Erin Pasak with Nutrition by Erin, and I'm really excited for another interview today. We have another chiropractor here, but with a different type of specialty who's going to talk to us about hiatal hernia specifically and the ways that she helps to treat patients. So first, I'm going to tell you a little bit about Dr. Emily. Dr. Emily Mayo is a family chiropractor. She's located in San Diego, and I recently connected with her and had the chance to meet her. She helps people from all walks of life, from newborns to actually 100-year-olds, and she helps people specifically with pain. She also helps athletes looking to reach their peak performance. She helps pediatric and prenatals, as well as has a specialty in sports chiropractic. So Dr. Emily, thank you for joining me today.
Happy to be here. Thanks for interviewing me.
Thank you. So first, can you tell us a little bit about your experience as a chiropractor, just a little bit about maybe how you became a chiropractor and the training involved with that?
Yeah, absolutely. Chiropractors, after you go and you get your bachelor's degree, chiropractic school is next. It's a 4-year program for the doctorate, and then of course there's clinicals afterwards. I studied under 2 different practitioners in 2 separate practices, and then of course the national board exams. There's actually 5 national board exams for chiropractors at this point, so it's quite involved. And then there's countless seminars and workshops that I'm going to get a little bit more specialized in the fields that I'm interested in and make sure that I'm staying up to date on all the latest research.
Very cool. So there's definitely a lot of training involved, and I know chiropractors work with a variety of different populations. What would you say is the percentage of people that you see that would come in for maybe a gut health concern or something related to digestive system?
You know what? I will have a very small percentage of my practice that come in because of gut health, maybe 5-10%. But of everyone that comes in, I would say 80% needs some work on different gut health issues. So it's not necessarily a main driver outside of course, hiatal hernia, which we talked about, and or some very severe issues. But most of those are, something that we work on once they're here for something else.
Okay, so it's almost like more of a secondary concern, but obviously it's a big part of the picture of health overall.
Absolutely.
So how would a chiropractor specifically help gut health or help specific types of digestive conditions?
Absolutely. So chiropractors, our main focus is the nervous system, brain, spinal cord, nerves going to every muscle, tissue, and organ, namely the digestive tract in the body. And what happens is if we have misalignments in our joints, that's actually my access point to the nervous system, whether it's the top of the neck all the way down to the pinky finger, or of course in the mid-back, more where those nerves are going to the digestive tract. If we have misalignments, we're compressing those nerves, so whatever's at the end of the nerve isn't working the way that it should be. So what I'm doing in the office is I'm analyzing for all these subluxations or misalignments and making sure that we're moving all of those segments back into place so that the nerves can function at their optimum level, and whatever's at the end of that nerve can function at its optimum level. Now, where that comes into play with joint or with digestive health is making sure that the proper nerve signal is getting to the digestive tract so that it can be functioning the way that it should be, essentially. Of course, there's some work we do with, and Erin, I know you do a lot of work with this in the office, making sure that the diet is proper, that we're not getting a lot of processed food, that we're keeping the inflammation level really low, but on its core level, making sure that the nervous system is working properly is how we adjust the gut health the best.
Interesting. So it's very different than like a physical therapy type of perspective. This is really, I have a different underlying root cause to addressing illness. So that's pretty interesting. Now, I had originally reached out to you because I was looking for help with a patient who had a hiatal hernia. And again, some people with hiatal hernias are not symptomatic and some are. So again, with this particular patient, we had kind of hit a roadblock with improvement in symptoms. And so I was looking for some alternative options for treatment. So can you tell me a little bit about how you might address that type of condition?
Absolutely. Now, a hernia or hiatal is when a portion of the stomach misaligns and moves up into the chest cavity. Now, just like any other misalignment I'm working with in the body, I'm analyzing to see where that part has gone so that we can bring it back to where it should be. In this case, namely pulling that portion of the stomach stuck in the chest cavity back down into the abdominal cavity. Now, we analyze and we do this with a very specific force and vector, pulling that stomach back down. It's a very gentle maneuver, but it does take a consistent force application and just making sure that we can get that back to where it needs to be. At that point, that area in the chest cavity that's expanded a little bit can heal, the size can decrease, so we keep it from happening again. Now, making sure that we are keeping the inflammation level again, something that people could be working with you, Erin, is important so that the healing can happen as quickly as possible. Now, when people come into my office for this, everybody's body is different, so there's not, one treatment protocol for everyone. The adjustment's the same, but sometimes the problem is entirely fixed in one visit. More likely, it takes a few visits to get it fully corrected. I've seen, somewhere between 3 and 4, I would say, is the average, but I've seen up to 7 depending on how severe the problem is. Most people, this adjustment works very well for. There's a couple people where sometimes there's additional factors involved and it's not going to be the 100% fix that they need, but people do get some really good results and some great relief with this adjustment and with the additional treatment that they're getting, making sure the spine is clear as well.
Cool. Now, it sounds like, oh, wow, just moving the stomach, but are there any risks involved, or is there any pain associated with this type of adjustment?
It is a very gentle adjustment, but when a portion of the stomach has moved into the chest cavity, it's not the most comfortable thing to move back into place. We always make sure to work slowly and make people as comfortable as possible, but I'm sure something that people can relate to is you're doing a really deep stretch in a muscle that's really tight. I always associate the pain or the discomfort level with that. So it's not something that's, it's not going to be a gentle, relaxing massage, but it's something that we're going to do to make sure that your body can function the way that it needs to.
Okay. Now, I believe this is something that a professional like yourself should be doing, and people probably shouldn't be performing this type of adjustment on themselves.
That is very true. You want to make sure that we're on the right place, which is very difficult to find, actually, if you're not trained properly. And again, as I mentioned, very specific force vector and application are very important. So it's not something that you'll want to YouTube and try at home. If we're moving things in the wrong direction, we can actually make things worse. So that would be the risk associated. The risk won't really be there in a chiropractic office. We're very highly trained for it. But if it's something you tried at home, there can be some pretty negative shifts that can happen.
Okay, good. So we want people to be safe.
Yes.
Now, if someone's not so lucky, they don't live in San Diego like us, and they can't come visit you directly, do you have any tips like where someone could go find someone with similar training, or is there some kind of training for this type of adjustment?
Not every chiropractor is trained in this particular adjustment. Doing a search in your area for hiatal hernia adjustment and chiropractor would be helpful. People who are trained in the technique of applied kinesiology, which is actually a specific chiropractic technique, even though I know that's something different in massage therapy, can be helpful. Or if people actually want to send me an email, I'm happy to, find a chiropractor within my network that's in your area, and we'll find somebody that can work for you wherever you are.
Cool. Those are great tips. Wow. On the topic, are there any other tips from, again, a chiropractic standpoint that you would give to your patients or someone that if they're trying to improve their digestive health?
Of course, from a chiropractic standpoint, get adjusted. I can't stress that enough, making sure that the body's functioning at its optimum level. Really work on nutrition, making sure that we're giving the body the proper exercise is important, but nutrition is huge. Whatever we feed the body is what the body has to build up the cells. So making sure we're eating very clean and trying to keep the chemicals out of our system. Both of those are very important.
Great. Well, I love it, and I think this has been very, very helpful, and I've learned a lot. So if people want to connect with you and maybe learn more about your practice or about what you do, how can they find you?
There's many ways to contact me if you want a little bit more information. My website is a great place to start. It's mayochiropractic.com. That's MAYO chiropractic.com. If you have more person-specific questions, people can email me at mayochiropractic@gmail.com, or calling or texting me off a cell phone is a great way to get, some pretty quick responses from me directly. And that number is 715-574-1810. So all good ways to reach me, whether you're looking for the general information or something very specific to what's going on in your body.
Awesome. Well, thank you so much for taking the time to talk today about this topic and, giving out your phone number and your email. That's very generous. So I'll go ahead and type up all the notes so that people can find you directly and get that information. And was there anything else that you wanted to talk about today?
As far as gut health and hiatal hernias, both of those I think we covered pretty fully. If people have any more specific questions on acid reflux, which is a whole different issue, or anything else, again, I'm happy to answer any questions from anywhere, wherever they may be.
All right. Well, maybe I'll have you on again about that topic, because that's definitely another hot topic.
All right. Thanks.
All right. Thanks. Bye.